My name is Hanis Shazana Mat Saad and my matrix number is 223163.
Assalamualaikum and hi everyone. My name is Nurhani Afika binti Badrul Hisham. My matric number is 225315.
Hi everyone, my name is Afika Ashra binti Azmi and my matric number is 223188.
Hi, my name is Nur Atika binti Muhammad Nisha Rizal and my matrix number is 225464.
Hi, my name is Normawani binti Muhammad Zulkifli and my matric number is 224484.
Hello everyone and Assalamualaikum. My name is Nur Alisha Humaira binti Muhammad Alhami and my matrix number is 224898.
We are from Group 5 and we are going to present our topic, which is vaccine hesitancy. In this presentation, we will be covering on the definition, factors, effects, example, methods, and conclusion. What is vaccine hesitancy? Vaccine hesitancy is the delay in acceptance or outright refusal of vaccination even when vaccination services are available. It is a complex issue that can vary depending on time, location, and the specific vaccine in question. The decision not to vaccinate is influenced by several factors, including a lack of confidence in vaccines or healthcare providers, complacency due to low perceived risk of disease, and issues of convenience such as access, availability, and affordability. Understanding and addressing vaccine hesitancy is important for maintaining high immunization coverage and preventing outbreaks of vaccine-preventable diseases.
Next, I will talk about the factors. Vaccine hesitancy is influenced by many different factors. People from lower socio-economic background or those with less access to education, stable income or reliable healthcare will often struggle to get accurate information. Some individuals resist vaccine policies due to mistrust in government. Others prefer natural immunity or alternative treatments based on personal or cultural beliefs. Religious concern and fear about vaccine ingredients also contribute. For some marginalized groups, past discrimination creates a deep mistrust in the healthcare system. Social influence plays a big part too, such as friends, family, and online networks can spread doubt or fear. And when stigma is attached to certain vaccines, people may avoid them just to protect their image. Together, these factors make addressing vaccine hesitancy a real challenge.
Now, let's explore the pros and cons, or more accurately, the positive reasons for vaccine hesitancy and the very real impacts it brings. Some people believe refusing a vaccine gives them, first, autonomy and personal choice. People want the freedom to make their own health choices. Second, precaution against side effects. Some are skeptical about newer vaccines like the mRNA COVID-19 vaccines, especially because of how quickly they were developed and approved. The third one is demand for transparency. Hesitancy has led to more public demand for safety data and honest communication. These concerns often come from fear, misinformation, or a lack of trust, especially when new vaccines are introduced quickly. But the cons of vaccine hesitancy go far beyond personal risk. First, it lowers herd immunity, putting everyone, especially the elderly and sick, at greater risk. Second, it leads to more disease outbreaks, hospital overload, and preventable deaths. The third one is trend on healthcare systems. More severe cases overwhelm hospitals and endanger health workers. Vaccine hesitancy doesn't just affect individuals. It has wide-ranging effects in healthcare, in the economy, in society, and in science. The truth is, vaccines protect more than just you. They protect your family, your neighbors, and even people you never met. Vaccine hesitancy is a challenge we can overcome through honest information, trust, and shared responsibility.
Next is example. There are two examples here, and the first one is polio vaccine hesitancy in northern Nigeria that happened between 2003 and 2004. There were rumors spreading about oral polio vaccine that was contaminated with anti-fertility agents, HIV, and cancer-causing substances. Some politicians and community leaders believe that this was part of Western conspiracy in washing out Muslim population. Past unethical practices like medical testing without consent in Africa also one of the deep-rooted mistrust on vaccine. And lastly, lack of engagement makes the health authorities fail to convince the society on taking vaccine. And next is anti-vaxxer. Anti-vaxxer is someone who opposes or refuses vaccine partially or completely. It happens because of personal, philosophical, or ideological, or even emotional reasoning. they spread misinformation about vaccine campaign, where they say that vaccine can cause harm. And it can cause autism, cancer, autoimmune disorder, or infertility. They also believe that vaccine contain toxic substances like mercury, while these small amounts were used safely as preservative or stabilizers, not like what they spread about. This vaccine refusal activity will impact on public health like disease resurgence and increased healthcare costs, where when they refuse taking vaccine, it can lead to outbreaks and makes them admitted into hospital and also get into emergency and need the treatment costs. Therefore, the healthcare costs will increase when they refuse taking vaccine.
Let us proceed with the method of prevention of vaccine hesitancy. The first way is establishing public confidence. This is because it can help to strengthen the confidence, trust, and effectiveness towards the public by getting vaccinated. Next is communicating through health campaign. Why? It is because the communicating through health campaign can increase the public opinion, counter false information, and talks about vaccines, especially for those people who live in a region with low acceptance rates, such as Russia. Other than that, engaging healthcare workers is also one of the strategies to prevent vaccine hesitancy. Healthcare workers such as doctors and nurses in your hospital can help to influence and be a role model to the public. This can be happen because their work field is vital, thus can show how important vaccinating are to people. Another step is monitoring and research. The researchers can increase number of studies and research to identify the hardships and carry out strategy to influence people getting vaccinated. The example region focus we can do is Central Asia and Africa. The last tactic of prevention is to improving convenience and accessibility. Responsible party in our country such as Ministry of Health could improve convenience including availability, affordability, and accessibility of vaccines acceptance. This is because when the process of getting vaccinated is easier to public, the more likely to go through with it.
In conclusion, it is clear that vaccines are an important method of prevention from many dangerous infectious diseases, and hesitancy towards vaccines would only do more harm than good. Although it is undeniable that vaccines may have side effects that can impair our senses or worsen our conditions, but society must try to see the bigger picture. They need to bite the bullet and realize that those side effects are mostly treatable, and even if they're not, it is still a small cost to pay in strengthening the community's immune system. Thus, we must sound the alarm and use our best effort in guiding those who are victims of vaccine hesitancy to prevent them from going astray and endangering not only themselves but also the society.